I'm Kim Walker, and I'm Professor of Healthcare Improvement, conjointly appointed with the University of Tasmania and St Vincent's Private Hospital here in Sydney. I guess my role is to close the evidence to practice gap. We've known now for about 20 years that there's a massive research evidence that tells us how we can produce the best outcomes for patients. There's a huge problem, however, translating all that research evidence into actual clinical care. So most of the research we do here is about helping clinicians of all stripes, doctors, nurses, allied health, to first of all be aware of the evidence in terms of their current practice, get them to talk about how that evidence might look if they were to bring it into practice, and then we work with them closely in teams to implement the evidence. It's called implementation or translation research. So we work at the opposite end to the laboratory end of research because it's a whole spectrum. So someone might develop a new medicine, they then might do some clinical trials to make sure that medicine's not going to kill people or make them worse off. And then you've got the business of actually getting that medicine in regular use. And so we devise things like clinical guidelines that give the clinicians some sort of process that they need to involve themselves in order to get the evidence into practice. When I started nursing, there was not much evidence floating around about what we should and shouldn't be doing. A lot of it was based on tradition. So that has been the drive for me. It has been this constant need to know that we can improve. Research is no longer about just the lone researcher doing their lonely little bit of research. It's all now about conglomerates of people coming together, like-minded, seeking the same outcomes, and then working together on the solutions. Most recently, we've instituted a Doctor of Health professional doctorate degree, but it actually brings the whole theory-practice thing together. Effectively, in doing the work we do to close the evidence-practice gap, we are unreservedly moving towards better health, because that is the problem. The problem is that patients aren't getting the sort of care that they deserve because the clinicians aren't using the evidence either appropriately or if they are at all. And so by closing that gap, we are indeed making the contribution towards better health.